Hi, my name is Rachel, and when I found out I was pregnant with my son, I was really, really excited to create a family. This is what the future was going to look like. As a new mum, pregnancy obviously was new to me. I didn't know anything about how maternity works, the process, what that looked like, and I realised there were so many appointments I needed to go to. Initially, it was once a month. It became 4 weekly, then 3 weekly, then fortnightly, until I got closer and closer to the due date, and it was so difficult to get interpreters because, as I said, I was having appointments nearly every week. They say to book interpreters 2 weeks in advance, so it proved to be so difficult. And also very disappointing because I wanted to know that information. You know, it was the first time I was on this journey, how the process works. I wanted the full information. So one of the appointments, there was no interpreter and I had to deal with it. And I went to a midwife checkup and they said, no, you need to go to an emergency ward for an appointment. And I just knew it would be absolutely impossible to book an interpreter. I asked the doctor, I asked the midwife, I was like, can you book an interpreter? Obviously, it is an emergency. This appointment could likely be serious. The doctor and the midwife, was a bit like, well, I've not really got any time, started explaining stuff to me. I was trying to lip read, really confused, didn't understand the jargon that they were using. I was saying, can you try and write down? Let's use the phone to transcribe what he was saying. Didn't understand it at all because everything was new to me. And obviously that made me quite emotional and I was worried. I had all these questions, but how could I type them all on a device? If I'd have tried to type, the doctor probably wouldn't have understood what I was trying to say because English is not my first language. BSL is my first language. So it was chaotic, no interpreter, and to be honest, it was awful. When the baby was born, I had to stay in hospital. The baby had to stay in hospital for 2 weeks. And through that period of 2 weeks, trying to sort out the interpreter was such a pain. I was so ill. Obviously, the doctor would come and see me last minute and would obviously have never booked an interpreter. And it was serious, these conversations. Medical-wise, I didn't know what was going on. So, in terms of trying to sort out the interpreters, it was so difficult. And I would try to FaceTime with a friend. The signal was so poor, blurred screen, very pixelated. I'd actually asked if I could use the NHS Wi-Fi that probably the medics were using. They said, sorry, we can't do that because for security reasons. And I just thought, where are my rights? I'm getting nothing here at all, And I couldn't kind of chase up with the interpreter at that time because I was so ill. So for the period of 2 weeks, I probably had 3 booked interpreters. It was really disappointing. And again, like I said, it was just really, really sad. So being pregnant with the second one, it's being mindful of having to, or make sure interpreters are there. I shouldn't have to do that. I should have a free mind. I should know that the interpreters are booked, but it's a constant responsibility to text for interpreters. Still even now when it's not my responsibility, should not have to do that.